First, I would draw a sharp distinction between unemployment insurance and any welfare program, because unemployment insurance, as the name implies, is insurance, which means people have paid into it. Actually, the employer pays it in, but it's on behalf of the worker. I think there may even be a legal challenge if you try to use failing a drug test to take people's unemployment insurance away. In fact, I believe there have been some court cases that have been decided that said you couldn't do it. Welfare is a little different, but I still would oppose that as well. For the simple reason, I think our principle should be, as a society, until someone has failed tests repeatedly, or as a result of alcohol addiction or drug use or whatever, has broken the law in some way or done things that they shouldn't do, like mistreat their children. And we do have a number of laws about children. That's a little bit different. But in this case, you're doing random drug tests. A person hasn't necessarily done anything wrong. They could be working. We have millions of people in this country who are alcoholics who go to work every day. So to single this group out because we can, to take their benefits away, I think it's not good policy. We should, if we want to identify them, it should be for the purpose of getting them in treatment and trying to get them off drugs. That is a legitimate purpose. We take benefits away from people on some welfare programs because they refuse to work. The goal of the program is to help them get back in the workforce, so it's directly related to the purpose of the program. And if they refuse because they're obstinate or for whatever reason, they can lose their benefits. And indeed, hundreds of thousands of people do lose their cash benefit every year because they refuse to work or participate in programs to prepare them to work. That is reasonable. Taxpayers have right to expect that people are going to be self-sufficient and going to strive to be self-sufficient. It is conceivable that their drug use could interfere with their work. If that could be demonstrated, or if it were demonstrated that it led to some behavior that was illegal or dangerous, for example, for their children, then that's a different case. But to randomly drug test and take that as evidence that they have failed in some way, I think is a mistake.